Since the first two confirmed cases of COVID-19 were reported in Namibia on the 15th of March 2020, much has happened and have been happening both before and thereafter. We would like the Namibian people to know our priorities and what is happening right now. Testing and finding of cases. It is critical to trace the contacts of the known cases so that we can determine quickly if others in Namibia became infected as well. This means expeditious identification of all those who had contact with the known cases and monitoring them for a period of 14 days based on the incubation period of the disease. When those people have symptoms, they are tested. We are also testing those with travel histories and symptoms that meets the case definition of suspected cases. The Robert Mugabe Clinic is now set up and operating for COVID-19 screening. This service will be made available in other areas soon. Testing is also taking place at private laboratories, especially through private hospitals. However, all test results conducted on specimens collected within our borders must be reported to the Namibia Institute of Pathology. This is important to ensure a truly national response. A 12-bed facility within the Windhoek Central Hospital complex, built with prefabricated technology, will be handed over by the contractor next week. In other regions across the country, especially at our district hospitals, preparedness has been scaled up. This includes preparation of quarantine and isolation facilities. Clinical management. For people who are sick with COVID-19 or any other similar illness, care is being provided. It has been shown from other countries that most people who contracted COVID-19 will have mild illnesses and will not require hospital care. But for those who do, we have prioritized the capacitation, training, and preparation of hospital staff, protecting our healthcare workers, increasing capacity of intensive care, and coordinating with the private hospitals. Points of entry. It is important to state that, in line with the state of emergency, only Namibians, holders of permanent resident permits, and persons domiciled in Namibia may enter the country. Those who entered the country are screened at points of entry and are subjected to 14 days supervised quarantine. There is a special dispensation for providers of essential and critical services in order to ensure that normal life in the country continues. Travel restrictions that government has announced means screening at all land, air, and sea entry points for those who still arrive in quarantine of those who are at risk of exposure in the countries from which they are coming. Lockdown of Khomas and Erongo regions. The latest measure is the lockdown of Khomas and Erongo regions, inclusive of Rehoboth and Okahanja local authorities areas. Communication to the public. We know that all Namibians want clear and factual information about the coronavirus and what is being done to help them be safe during the pandemic. Unfortunately, much false information is spreading on social media and in other places. We are aggressively expanding our ways of reaching out to communities and stakeholders. We have had frequent press briefings, radio and TV appearances, community engagement, and publication of information, communication, and education materials. This will continue and will be adapted to reach all Namibians' population. This is an evolving pandemic, and we want to keep pace. Our COVID-19 information hotline 008 00 100 100 remains operational. We continue to take hundreds of calls, and operators provide correct and authenticated information and advise Namibians who have concerned. With these priorities in mind, we shall continue this fight, and we call on all Namibians to join the fight. There is much that can be done by all of us to stop the spread of COVID-19. Washing our hands with running water and soap, staying away when we are sick, avoiding face touching with unwashed hands, avoiding crowds and gatherings, and staying informed. It will take all of us, but Namibia will rise to this occasion. Confirmed cases in Namibia. 3 new confirmed cases were reported yesterday. These are numbered as number 9, number 10, and number 11 respectively. These cases are also travel related. Case number 9. Case number 9 is a 35-year-old Namibian female who resides in South Africa, came to Namibia on the 20th of March. On the 24th, she was attended by a private medical practitioner and was advised to go for testing at Pathcare. The samples were taken and sent to National Institute of Communicable Diseases in South Africa on the 25th of March. The test results was reported positive on the 28th of March. Her condition is stable. An arrangement has been made for her to be admitted in an isolation facility. Case number 10. Case number 10 is a 33-year-old Namibian female who traveled to Dubai, then Ethiopia, and then Johannesburg during March 2020. She arrived on the 17th March in Namibia, visited the health facility on the 26th. Specimens were taken and sent to NIP laboratory. The results came out negative. The last case, case number 11, is a 69-year-old Namibian male who traveled to Johannesburg, South Africa, and came back on the 12th of March 2020 in Namibia. He visited a health facility on the 25th March. Specimens were taken and sent to NIP on the 29th March 2020. The results came out yesterday, the 28th of March, and is positive. The Ministry of Health and Social Services-led response is actively following up with all contacts of these persons to ensure proper quarantine and monitoring for symptoms. As a reminder, all Namibians should be adherent to the regulation described during the declaration of a national state of emergency on the 27th March 2020 by His Excellency the President, and the lockdown strategy which was implemented as from the 27th of March to the 17th of April 2020. People are urged to stay at home. They are encouraged to avoid crowds and maintain personal hygiene. In conclusion,